Dr. Sylvester, I'm going to explain to you a little bit about bunion surgery today. We get this condition a lot in our office, and many people come in and are interested in possibly correcting their bunion deformity, and so they have a lot of questions. First one is recovery. Everybody's interested in what it takes to get over a bunion surgery, and here's what I tell my patients. I say, okay, go home, and the first 4 days after your surgery, lay down and keep your foot up on 4 or 5 pillows, and don't really do much other than go to the bathroom. After 4 or 5 days, you can put it down more often. The reason you keep it up that amount of time is that's about the time it takes for all the internal bleeding to stop, and it doesn't want to swell up too much after that. Now, when you put it down, you really don't do yourself any favors. So I recommend all my patients with bunions use a knee scooter. You don't have to. You can walk on bunion surgery afterwards. If you have the right hardware and the right doctor, it's okay to walk on it. You don't need a cast or anything like that. You do need, I like for people to use a boot, like a compression boot. It's a Velcro-on boot, and they walk mostly on the heel to keep pressure off the bunion if they do walk on their foot. After about 3 weeks, most people can get back into a tennis shoe if it's loose. After 6 to 8 weeks, they're feeling pretty good. Like, that would be the time if you want to plan a trip to someplace where you're going to walk a lot of the day, then you probably ought to wait about 2 months after your bunion surgery before you do that. If you ride a bike for exercise, you can do that within a couple of 3 weeks. If you lift weights, you can do that within a couple of 3 weeks, as long as you don't stress the foot. But running and things like that, you're going to have to delay it for 2 or 3 months afterwards. Secondly is recurrence. A lot of people have a concern about their bunion coming back. It's very common. If a bunion isn't corrected pretty accurately, then they can come back. And so selection of the doctor is pretty important as well. Make sure that they have a catalog of bunion surgeries that have been successful over a long period of time. There's a new procedure called the Lapiplasty. What that involves is fusion of this joint. If you look at this bunion deformity, I'm going to hold that. Can you see that okay? Okay. If you look at this, the primary deformity is right here at this joint, and that's called the metatarsal cuneiform joint. And what happens is it becomes unstable, and the first metatarsal, which is this bone right here, deviates to the outside. So when we correct a bunion, we usually address it at that joint most of the time, because that's where the primary deformity is. At least in our clinic, and Lapiplasty is one type of that procedure. There's lots. All Lapiplasty really is a fixation technique with some guides that help you do that procedure, but I've been doing the procedure for about 30 years, so I really don't need the guide anymore too much, but it's a type of that procedure. There was a man named Lapidus that described that procedure to fix a bunion, and this is kind of what it looks like afterwards. So this is a patient we did, and in her case, she had a little rotation deformity in her metatarsal head, so she had another procedure there, but you can see sort of the before and after procedure, what it looks like when a bunion's appropriately corrected. If you get a recurrence on a bunion deformity, it's probably the fault of the doctor, and that's happened to everybody. Don't let anybody fool you. It's happened to me, it's happened to everybody. And so the goal is to get everything pretty much perfectly straight. And if you can do that, then you don't have recurrences. What's the success rate as far as pain relief? Pretty high, somewhere in the area of 90 to 95%, and most clinical studies show people are satisfied with their bunion deformity. Actually, if you look very carefully at most of those studies, almost all of them that are unsatisfied have recurrence of the deformity. So the critical thing with fixing a bunion deformity is making sure it's perfectly straight. The next thing is scars. What kind of closure do we use at our clinic? We generally use a running intradermal stitch, so the scar is very small. We try to keep the damage to the tissues to a minimum. Shoe gear afterwards, most of the time you can return to normal shoe gear without any restrictions. Some other questions that come up is how painful is it? I've had lots of people not take any pain pills, but I tell everybody it's probably going to hurt for the first 4 or 5 days, the week, and after that it's just swelling, because it's going to swell. And it's going to want to swell for probably 3 or 4 months. So we always use a compression anklet after the surgery that we give the patient after about 2 to 3 weeks. We give them this anklet to wear, and then that kind of controls the swelling. So I hope that's answered any questions you have about bunion surgery. The critical things are, make sure that if you don't correct it appropriately, it does come back. It's about 3 weeks to get back into a regular shoe. It's about 2 to 3 months to get back to every regular activity you want to do. And the first 4 or 5 days are really important. You've got to lay down and keep your foot elevated, and that keeps you out of a lot of trouble. And the other risks of bunion surgery is sometimes the bones don't heal well, but that's usually associated with somebody that has a vitamin D deficiency or calcium, and we always check that or make sure that the patient's on some type of supplement to support that. Anyway, thanks for listening.